I've listed page numbers for the books that were, well, the book I'm going to be lecturing from is Iggy. I know some of you may have the 7th edition, some of you may have the newer edition. I think I know the pages are from the newer edition. I've also got listed, let me go up here, Giddens, which is a resource book. These are things that you can read if you have time and if you want to read, but I'm not going to be lecturing from Giddens. But it's a resource that you can go to that also has information on metabolism. Kaplan Nursing, I understand y'all don't have the newest Kaplan, y'all don't have your Kaplan Nursing book yet, so y'all can kind of ignore that one. I was talking to Ms. Hyde this morning, and she says that she thinks that Kaplan wants everybody to download the ebook. So, and that I asked her, had y'all gotten your copies of Kaplan, and she said no. So
yeah, Miss Ward brought it to us. It's the green book. The green book, Miss Ward brought it.
Do y'all have it?
Yeah.
Okay, then the chapter on endocrine, that's another resource, and that the one in the chapter number I have up there is probably not the correct chapter.
Did we get a new one each semester?
No.
Okay.
No. And then the pharmacology book, I love that book. The practical nursing students use Key and Hayes, which I also love. But I made myself use that this time and read all the stuff on diabetes and obesity and thyroid problems, and it is such a good resource. So I'll be lecturing some from that book too. So I would suggest you read that material. Let's see what else is up here. On the maternal and child care book, the 5th edition, I just realized what I did now. I uploaded the maternal and child care from the PM book. You know what? I'm going to leave it up there because it's got good information. I had taken away everything except thyroid problems and diabetes, and so y'all might want to look at that. It's all in dark blue, so if you print it, make sure you tell your computer you want it to print in black and white because it'll take up all your ink on your printer. But let me tell you about the childhood diseases. Of course, children have diabetes, so we'll be talking about children and diabetes, and what I'll be doing as I go along is I'll be talking about the differences. And frankly, there's not a whole lot of differences as far as signs and symptoms and the treatment and all that, except, of course, children have smaller doses of everything. Same thing with thyroid problems. The one we're going to really focus on with thyroid problems is hypothyroidism in children because that's congenital hypothyroidism, and if they're not treated, they will become mentally retarded. They have growth retardation, and also they will be mentally retarded. They're called cretins. It's cretinism if you have hypothyroidism and it's not treated. Now in the United States, it's a law that every child that's born in the United States is checked for hypothyroidism because the treatment has to start immediately. So we'll be talking about that. So I'll be talking about differences, okay? Let me see here. And what I've said on here, it's your responsibility to read this information because I will be talking about differences in class, but I'm not lecturing from those books, from that maternal and child care book. One of the things we have to talk about in here is, one of our objectives is that we have to talk about, let me come back to the middle so everybody can hear me. We have to talk about 2020, Healthy People 2020, and particularly about obesity and about diabetes. So I have a PowerPoint up here that I have, and this is just for you to this PowerPoint addresses the goals and everything about it as far as obesity and diabetes mellitus as far as Healthy People 2020. Don't try to memorize that stuff. Read it, think about it, but don't try to memorize it, because I'm not going to ask you a question on the test that says, what is the goal for obesity or what is the goal for diabetes? That's not the way I test. I test, when you're thinking about my test questions, you think about nursing care, application. So read over that. Don't try to memorize any of it, because I'm going to focus, the focus of the test is going to be on diabetes, it's going to be on the thyroid problems, and there'll be a few questions from obesity. I'm not going to go over this PowerPoint, but what I want to tell you as far as, I'm going to have to keep reminding myself to go to the middle of the room. What I want to tell you all about the goals for obesity, and again, just listen to me. Don't write this stuff down, just listen to me. The 2020 goals for healthy people for obesity are as follows. They want to reduce the proportion of adults who are obese by 10%. Do you know how many people in this country are obese? Oh my mercy. It's unbelievable. That's why we have diabetes in young people. We are seeing type 2 diabetes in people in their 20s and their 30s. And you know who should have type 2 diabetes? Older people. Not people in their 20s and their 30s, and even in their teens. And it's because we have a population that's obese. So we want to reduce the incidence of obesity in this country by 10%. We also want to increase the proportions of adults by 10% who have a healthy weight. And you can find healthy weight. Have any of you ever seen those charts that's got your height and your weight, and it tells you the range you should be in based on your height and weight? That's a standard. And that's what we use to decide whether you're within that healthy range. And that's where we want to increase the number of people that are within a healthy weight by 10%. We want to get people to go to their doctors and talk about weight reduction, to be counseled about weight reduction. That's one of the goals. To increase the number of people that are visiting their physician and talking about weight reduction, how to bring their weight under control. And we want to increase the number of primary care physicians who measure BMIs. Everybody know what BMI? Body mass index. Y'all have to do that for your nutritional assessments. You've done that. Not all doctors do that. My doctor does it. But we want to increase the number of physicians that are doing that. They're looking at body mass index for their patients to see if they're overweight, underweight, obese, or extremely obese. Okay. We want to increase fruits and vegetables in people's diet. Fruits and vegetables. And we want to decrease the amount of saturated fat in our diet. Do you know how much in this country that we consume as far as fats in our diet? First of all, let me talk about Europeans. Europeans' diets are low in fat. They consume about 10 to 15% of their daily caloric intake as fat. Sometimes we consume 50%, 45, 50. It's no wonder we're obese. It's no wonder. So we want to decrease the amount of saturated fats that people have in their diet based on the number of calories they take in a day. So those are the goals. And as I said, I don't want you to memorize them. I do not want you to memorize them. I just want you to understand them. So let's talk about metabolism. Let's talk about obesity. And again, don't memorize these numbers. I'm not asking you numbers on the test. This is just information. So since I'm going to be walking to the middle of the room, I'm going to have to be walking back up here because I don't know that clicker works. I don't know. There's more than 72 million people in this country that are obese. Did you know that? one out of every 3 persons is considered obese. 10% of Americans are morbidly obese. And as I said earlier, there's an increasing incidence of obesity in children, and that's why we're seeing type 2 diabetes in children. And this is a preventable health problem. We can get this under control if we get people to take control of their lifestyle, because really it's a lifestyle. It really is. I know I have fought my weight all my life. Over the last year or so, I've lost about 20 pounds, but as you all know, I've been ill. I was in the hospital and I had surgery. I had lost about 10 pounds before that, and I lost about 10 pounds during that surgical process. But that's wonderful. That's wonderful, because I've also shared with you all that I have type 2 diabetes, which has been under control ever since I was diagnosed, and I don't take any medicines, thank goodness. But we need to get our weight under control, because if your weight is increased, what kind of chronic health problems are you at risk for? Diabetes, heart disease, which includes hypertension, coronary artery disease, especially if all your fat, if you're eating these high-fat diets, it's clogging your arteries. So you're at risk for all these diseases. Plus, all that excess weight puts pressure on your joints, osteoarthritis, joint pain, all those things. We'll talk about some of this. Gallstones, cancer. Does it sound ominous? So we need to think about obesity as a chronic medical condition. Very difficult to treat. Very difficult. And most people who are obese and lose weight, they gain it back within about 5 years. Now, we'll talk about some of the things like gastric bypass. We're going to talk about that when we get to the end of this, gastric bypass. A lot of those people have maintained their weight loss for a lot of years. But most of those surgical procedures, some of the other surgical procedures that they do are not as successful as gastric bypass. If you lose weight, if you lose 5 to 10% of your weight, it decreases your risk of diabetes, of cardiovascular disease. It will decrease your blood pressure, all those things. Look at North Carolina here. This tells you the prevalence of reported obesity in North Carolina, and if you look at North Carolina, it's hard to see those shades, but I think North Carolina falls into about the 25 to 30% range of obese people in North Carolina. That's just for your information. But again, that's something to think about, isn't it? Okay, I'm going to define some terms for you, and I'm going to tell you the terms you need to know. One of the things you need to know for this test is BMI. You need to know all the things that the ranges of BMI means, okay? Remember that height and weight chart that I told you? When we say a person is overweight, we're comparing them to that height and weight chart and to that range. I can't remember exactly. Let's say to be 5 feet, maybe it says that you should weigh between 100 and 110. Well, that's the range. So if you weigh more than 110, and I'm making this up, if you weigh more than 110, then you're overweight. Okay? Okay, so when we think about overweight, it's determined by weight compared with height. We also consider the BMI, and we also consider waist circumference. Waist circumference, if the larger your waist circumference, the more at risk you are for cardiovascular disease. Did you know that? Okay. The larger your waist circumference, the more you are at risk for cardiovascular disease. And the larger, when a person has a large waist circumference, we say that they have central obesity. See that last one, central obesity, when they have a large waist circumference. Obesity is also determined when we compare BMI with height and also waist circumference. But we're really talking about excess body fat. We're talking about excess body fat when we're talking about someone being overweight or being obese. Let me go back to overweight, because this is something I want you to know. A BMI of 25 to 29.9 is considered overweight. A BMI of 25 to 29.9 is considered overweight. Now, I am not going to ask you to learn all of these things as far as numbers, but that one I want you to know. I want you to know these about the BMI. A BMI of 30 or more is considered obese. And then we have extreme obesity, or morbid obesity, whatever you want to call it. Morbid obesity is extreme obesity, and it's a BMI of 40 or more. And many times these patients are 100% over their ideal body weight. Can you imagine 100% over your ideal body weight? You know, there's a program on television about my 600-pound life. I can't even look at that. I just can't even look at that. Now, when they're morbidly obese, do you think they have a lot of these life-threatening problems that we talk about, like hypertension, cardiovascular disease, diabetes, all these things? Yes. Yes. As I said, the waist circumference is a strong predictor of cardiovascular disease. So if you've got somebody, I know it's the nurse in me, and I can't help it, but when I see somebody that's got a large middle, I'm just thinking that's a heart attack looking for a place to happen. Really. And a lot of times it's men that have these big waist circumferences, and they need to lose weight. Okay. This next slide is just an example of one of those height and weight charts that I told you is the standard that we use. We use that standard along with the BMI and the waist circumference to determine being overweight and being obese. Some of this we've already talked about, but let's
According to that, underweight.
Okay, we've already talked about the ideal body weight. I've told you the ranges, and I've told you that I want you to know those. We haven't talked about ideal body weight. We talked about BMI. The ideal body weight is when you look at that height and weight chart, and you look at that range, and I'll go back to, say, a person that's 5 feet, and we're going to pretend that it says they should weigh 100 to 110. Well, the ideal body weight would be the midpoint of that range, which would be 105. I made that up to give you an example of how you get to the midpoint, because I don't know what it is for someone that weighs 5 feet. And we talked about body mass index, so we're not going to go over that, but know those numbers. Okay. We talked about waist circumference. We talked about central obesity. So I think we can go on. Oh, waist to hip ratio. Let's talk about that. Waist to hip ratio is also a determinant of cardiovascular disease. It's a predictor of cardiovascular disease. And It indicates excess fat in the waist and the abdomen. And I'm just going to give you some numbers, but don't memorize this for the test. 0.95 or greater in men is considered elevated. 0.80 or greater in women is considered elevated. And I'm not asking you that on the test. And the next slide. Okay, how do we determine what causes obesity? We don't know. It's very complex. It's different in different people. There's a lot of things that play into whether a person is obese or not. We have hormones in our body that work together that affect appetite and also affect fat metabolism, and we're going to talk about some of that. You see the thyroid hormones, the insulin, and the leptin under there. When we talk about thyroidism and we talk about persons who have hypothyroidism, which is not enough thyroid hormone, one of the signs and symptoms of that is they gain weight. But what they found out is that most people that have an obesity problem, it's not because of their thyroid hormone. Now, it can be, but most of the time it's not. Okay? Insulin is also a hormone, and insulin is associated with the insulin resistance. When we talk about diabetes and we talk about insulin, one of the problems, insulin has to carry glucose into the cells for the glucose to be metabolized as energy. And on those cells, you have receptor sites. And those receptor sites has to be receptive to the insulin for that insulin to be able to carry the glucose into the cells. And so one of the things with people who are obese is that they have insulin resistance. And that way the insulin can't get into the cells because the cells, those receptor sites are resistant. So that's another thing that may be playing a part in patients who are obese. The other thing is leptin. Leptin is a hormone. And in someone who has no problem, it controls your appetite. Actually, leptin is released by the fat cells, and it acts on the hypothalamus in the brain. Does everybody remember the hypothalamus is in the brain? And it helps control appetite. But in people who are obese, there's some theorists who believe that there's decreased resistance to leptin, and so it's not working in the person who's obese, so it doesn't control the appetite. What it does is, in the person that it's working, it tells you when you're full. Satiety means your fullness, and it tells you when you're full, and it helps control appetite. That's why they tell people who are trying to lose weight to eat slowly, because it takes about 20 minutes for you to feel full. And so if you eat slowly, if you take small bites and chew and eat slowly, then you won't eat as much. So that's one of the things that, as far as one of the etiologies, is that it could be these hormones that are playing a part in a person being overweight. When we go to the top there, it says nutrients in food provide energy. And what happens is, what you have to do is, however many number of calories that you take in, you have to burn those calories off through exercise, moving around, whatever, or else it's stored as fat. Excess calories are stored as fat and stored as triglycerides. Okay, I think we've covered everything on that slide. Y'all tell me when it's time to find it wound up and I'll get it time. Okay, talk about some other things that third party. Environment. What else plays a part in a person being obese? Environment plays a big part. We consume high cholesterol diets, high fat diets, especially saturated fats. And it increases our weight. Trans fats are in everything that we buy, all that processed food that we buy. Do y'all read labels? Do you try to stay away from the trans fats? Do you try to stay away from the things that are high in saturated fats? You should. You should be reading labels. I'm sorry, say that again. Say it louder. I don't know. Does anybody know? She said, did they pass a law that there shouldn't be trans fats in foods? I don't know. Also, trans fats and saturated fats and cholesterol are associated with obesity. What do y'all do when y'all get out of class here? If you're hungry, where do you go? Maybe you go home. Do you go to fast food restaurants? Do you go to fast food restaurants in the morning and get a biscuit? Well, that's what our culture is. You know, we're exposed to fast food, prepackaged food that's high in cholesterol, high in sodium. Snacks are high in trans fats. All of that plays a part in people becoming obese. It could be genetic also. There could be a genetic predisposition to being obese. We talked about the hunger center in the hypothalamus, and that it controls satiety. It tells us when we're full. It gives us the message to stop eating. And we've also talked about leptin, and that leptin's not working properly in people that are obese. And did you know that if you have parents that are obese, you're more likely to be obese? They've done research on it. If you have one or more parents that's obese, then you're more likely to be obese. Now, neither one of my parents had a weight problem. I don't know what happened to me. Okay. And then it's behavioral. Physical inactivity. Exercise is one of the most important components of trying to lose weight. Exercise. So, what do we do in our country? What do we do as far as our culture? We're sitting in front of the TV. We're sitting in front of the computer. We're playing on our iPad. We're playing some kind of electronic game, right? We're on our phone, right?
Right.
I mean, we need to get up and get outside and be moving. And we need to get kids up and outside and moving. Walking is the best exercise, aerobic exercise, that we can engage in. And it's free. You don't have to go to a gym and get on the treadmill. You can just get out here and walk. Okay. And then there are some drugs that can increase our weight. And you've probably heard of some of these already. Corticosteroids will tell the body to hold on to water and cause your weight to increase. The NSAIDs can also cause weight gain. Some antihypertensives can cause weight gain. And some oral anti-diabetic agents can cause weight gain. Some oral anti-diabetic agents. And then as far as some diseases, we've already talked about hypothyroidism. And another one that can cause weight gain is Cushing's syndrome. Cushing's syndrome. Cushing's syndrome is an endocrine disease. and it can cause weight gain. Tells the body to hold on to water. Risk factors for obesity, we've really covered some of these already. We talked about the genetic component. If you have here, consider it are obese, you're at increased risk to be obese. We haven't talked about the psychological. Self-esteem. If you have low self-esteem, what might you do? You might be eating all the time, binge eating. Stress, absolutely. Do y'all eat when you stress for a test? Yeah. We've already talked about the physiological component. We've talked about physical inactivity, and we've talked about environmental, the food supply, fast foods, all that kind of stuff. We haven't talked about sociocultural yet, though. What do we think about obesity in this country? We think obesity is ugly, don't we? And we think about lean, slim is beautiful, right? So I think especially women are under constant pressure to lose weight because leanness is attractive in this country and fatness is considered unattractive. So again, people who are obese are under pressure to lose weight. But what happens is that many people that lose weight gain it back. So it's self-defeating. It's self-defeating. We've alluded already to the fact that if you're obese, that the complications that can occur are many. There's many consequences related to obesity. Morbid obesity, I've got up there, greater than 200% of the ideal body weight. Mercy. The risk of dying is 12 times greater. 12 times greater. Young people that, occasionally you'll hear about a young person just dropping over dead, and many times they're grossly obese, they're morbidly obese, and their heart just gave out because their heart, you have to think about when you have someone who's morbidly obese and their heart is pumping blood through that circulatory system, that heart has to work harder to get that blood through that circulatory system. So over time, their heart's going to wear out. We've already talked about cardiovascular disease. Now, this is something I want you to know. I want you to know metabolic syndrome. 60% of people who are obese have metabolic syndrome. And metabolic syndrome is where they have increased waist circumference. And we've already said that's a strong predictor of cardiovascular disease. By the way, am I talking too loud? No. Okay. And they also have hypertension. And I don't know if y'all studied cardiac yet. I doubt you've gotten to cardiac yet. But if you have someone who has hypertension, they need to stay on their medicine because over time, hypertension can cause congestive heart failure if it's untreated. So hypertension is one of the things that you see in metabolic syndrome. You see increased waist circumference, you see hypertension. You also see elevated blood triglycerides and fasting blood sugar. Elevated blood triglycerides and elevated fasting blood sugar. Elevated fasting blood sugar. And they also have a low high-density lipoprotein, or high-density lipoproteins cholesterol. You know the good fat and the bad fat? When you look at lipid profile, your high density are the good ones, and they need to be high. And your low density are the bad ones, and they need to be low. So what happens is they have low high density, and it should be high lipoprotein. Now, another thing that you'll see in people who are obese, and this is your males, they will have decreased androgen levels, and your androgens are your sex hormones in males. Particularly, we're talking about testosterone, and testosterone is important for the development of those male characteristics, like the changing in the voice and growing hair and all that kind of stuff, those male characteristics. In women, you'll see menstrual irregularities for women who are obese. So there's all kinds of problems that go with being obese. We'll talk about a few more of those problems. I've already alluded to some of them. But look at this. Gallstones, cancer, some types of cancer, colon cancer in men and women, prostate cancer in men, breast cancer in women. Being obese increases your risk of those cancers. Osteoarthritis, those musculoskeletal complications. The more obese you are, the more pressure there are on the joints. They rub together, and that cartilage is rubbed away, and they'll end up having lots of pain. Cardiovascular disease, we talked about that. Hypertension, MIs, congestive heart failure, type 2 diabetes, depression. Did you know that obese people have more postoperative complications? Think about an obese person, somebody that's got a big, pendulous, obese belly, and they go in, they cut that belly open because they've got to go in and do something, some type of surgery, and they sew it back up. There's not a lot of capillaries in that fat, all that fat, so they have trouble healing. They're at risk for that wound opening up. So they have trouble healing, and they're at increased risk of infection. Hypertension, increased weight gain, increases blood pressure. Stroke, peripheral artery disease, arteries. High cholesterol, we've talked about that. So all these things. I think on the next slide we've said everything except it's got these the ranges. Make sure you know the time. So I don't think we have to talk about this anymore. Love this slide. Love this slide. Again, this shows you some of the things that can come about as a result of obesity, some of the complications. And I think we've talked about most of them. We did talk about social discrimination. We did talk about impaired mobility. How many times have you seen the extremely, and I'm not making fun when I say this, guys, but how many times have you seen the extremely large, obese person in the grocery store riding in one of those carts that's motorized? That's what those carts are for someone like that, because, they have trouble walking. Not only do they have trouble actually walking, but they get extremely short of breath when they walk because they're carrying around all that weight. So, limited mobility, but have you thought about the social discrimination that comes with obesity? Do you think that an extremely attractive person goes in and applies for a position, and then a very large person, extremely obese person, goes in and applies for a position, and they have the same qualifications? Who do you think they're going to hire? they're going to hire the attractive person more than likely, don't you think so? So there is a lot of discrimination as far as people that are obese. I think we talked about most of this. We didn't talk about the new thing thrombosis, but we talked about peripheral artery disease. Okay. Let's talk about the treatment. The treatment is collaborative. It focuses on reducing the health risks and changing their eating and exercising habits. Those are the two main things. But you've got to get that psychology going on within the person's brain. They've got to internalize that they need to lose weight and that they need to change their lifestyle. Because you can write as many care plans, you can talk to them until the cows come home, but until they accept the fact internally, until they internalize it within themselves and psychologically that they need to do this, it's not going to happen. So we're really talking about behavior modification. We're talking about them changing their behavior, changing the way they eat, and changing their exercise pattern. That's what we're talking about. So the first thing we're going to do is we're going to talk about diagnostic tests. First of all, their BMI needs to be measured, and we're not going to go into that again. We've already talked about that. Anthropometric measurements need to be taken. These are a non-invasive method of evaluating nutritional status, and it includes height and weight and assessment of body fat. They can also do skin fold measurements, such as the mid-arm circumference and the calf circumference. Some other things that your book talks about, and these are more sophisticated measurements of, as far as diagnostic tests. One is underwater weighing. And what they do with this is they determine the percentage of body fat to lean mass. And a person with more body fat will weigh less underwater. So they weigh them underwater. And if you have more body fat, then you will weigh less underwater. Another one is bioelectrical impedance. And that's where they send harmless electrical current through the body, through the tissue. And it measures the resistance of the body tissue to that harmless electrical current. And it calculates body fat within the body. But those are more sophisticated tests, and I would assume that those would be done at a place that their entire focus is weight loss, like a hospital unit that has their entire focus is weight loss, or maybe a clinic. We talked about some of these things already, but I'll just briefly go over them and then we'll be ending it for the day. We've talked about waist circumference. They're going to measure waist circumference when they're doing their workup on a patient who's obese. And the other tests that they're going to do, of course, they're going to do a thyroid profile. We've talked about that to see if the patient has a problem with hypothyroidism, which could cause them to gain weight. They're also going to do a serum glucose. They want to see what their glucose level is because they could have insulin resistance. They also want to look at their serum cholesterol. Did you know that the normal cholesterol is 160 to 200 milligrams per deciliter? You probably need to know that one too. 160 to 200 milligrams per deciliter is a normal cholesterol level. They're also going to do a lipid profile where they're going to look at not only the cholesterol level, but they'll look at the HDL and the LDL, the high density and the low density lipoproteins, good and bad cholesterol. That also includes triglycerides also. And then they'll also do an EKG, an electrocardiogram, to see if there's any cardiac problems going on. And they'll also do a total lymphocyte count to see if there's any infection going on. Because your people who are obese have an increased risk factor as far as infection is concerned, particularly due to the degeneration of the musculoskeletal system as they become more and more obese. Okay, let's stop here. And tomorrow we'll start with hemoglobin.
I need a brain break.
You were supposed to work last night. There's no way you should have done that.
I was going to. Sorry, I was going to.
Can I show you? Scratch paper. And do my paper.
Yeah, you'll feel so much relief when it's all over, but I think
I made it
she can let you at least on Tuesday.
just one piece of one.
Oh, so you don't have to do your check on Tuesday.
And she told anybody that had done
Did you mess
all
up
the
on the math?
items correct, like most people missed the first one. And then anybody did all the items, so maybe they can go ahead and check off. And the one I did was on the item. That's the part I want. It's all right. I got one.
Stopping in my face.
You dropped some. I'm going to see if I can get it right.
You have to have you have one because I called the one.
I don't, but I had anatomy and
Oh, so, and they gave that to you? Because whenever I called the woman, she said that you had to have a disorder or a learning disability.
I thought I had
You'll probably get it. What? Who did I call?
I think you said the lady you talked to.
It was some woman, Miss Walker.